are scared to speak up, especially young kids, because of this idea of you get your bell rung, get back out on the field, and shut the hell up. Here's some more stats. This is from the Clinical Journal of Sports Medicine. 66.4% of young people didn't think the injury was serious enough. 41% said they didn't want to be withheld from competition. 36% weren't aware of their concussion. Whose responsibility is this, though? Is it the athlete's responsibility? Is it the coach's responsibility? Is it the parents that are watching on the sideline?
Probably everybody involved, right? You can't put the onus on one person.
Right, well, and I think what you talked about having an advocate there, somebody who's looking out for the welfare of the child so that, you know, the needs of the team don't overcome the needs of the child, because the child is always going to want to impress his classmates, his teammates. He's going to want to impress his coach. I mean, he's living for that, right? To make sure that his coach is proud of him. So having somebody there that says, no, you're not allowed to get back in the game, even if he wants to.
Well, athletes make bad decisions all the time. Okay, and I mean, you take an athlete, look at the Robert Griffin III injury. He came out, he had an injury. You know, should he go back in? He felt he should go back in, so he did. All right, so we just asked him, do you want to go back in? Yeah, I want to go back in. But now you're not talking about a knee, now you're talking about a concussion, and a concussion affects the way that you think. So you have a kid who is probably going to make a bad decision to begin with, and on top of it is not thinking clearly because he had a concussion. So I often say, you know, asking a concussed athlete whether they can go back into play is like asking a drunk driver whether it's okay to drive. He's not going to have the right answer to that because they're not thinking clearly.
Well, we all know that professional athletes are no strangers to injuries, and I guess you could say that in the NFL in particular. But what happens when the brain trauma really carries through into later in life, leads to ALS, leads to dementia? You know, how do we actually work through this? What do we need to address, especially if the NFL isn't going to do it? And I guess one of the questions, too, is how do we protect our kids in the future? What are the steps that we can make for progress? That's what we're going to talk about today. And joining me here, Jacob Soberoff. Hello, hello.
Hello.
And then in our hangout, we've got Jenny Witt, who's the creator of Mama Toga, parenting website based out of Saratoga Springs in New York. Carmen Gentile, who's a freelance correspondent at USA Today from Pittsburgh, Pennsylvania. Dr. Andrew Blecher, a sports medicine MD at the Southern California Orthopedic Institute in Los Angeles. And Imani Fenton, defensive backs coach at Cornell University in Ithaca, New York. So hello, everyone. Thank you so much for joining us today. You know, where do we really begin? You know, Doctor, why don't you start by telling us, just from your perspective, do you think that there is enough information out there? Do you think that the NFL is doing enough? You know, I mean, do you think that there's perhaps enough information out there to say that they are willingly putting people in harm's way, the way that Jacob just brought up, you know, with the tobacco companies?
Well, let's start off talking about what puts the brain at risk. Anytime you step on the football field, at any level of sport, be it the NFL, high school football, college football, youth football, et cetera, there's always a risk of injury, and that includes a risk of brain injury. So if you're going to play football, there's a certain amount of risk that you're going to take. The question is, are we doing everything possible to minimize that risk? And, you know, that is really an open-ended question, because we don't know what the answer to is. What is everything that we should be doing to prevent and to maximally minimize the risk? One of the biggest things that we need to do is increase awareness. There are so many people out there that don't know what a concussion is.
Absolutely.
That if you can't start off by saying this is a concussion, then how do we know how to prevent it? How do we know how to identify it? How do we know how to treat it? So the first step is education and awareness, and that's true for players, for parents, for coaches, for people in the medical field. I still come across on a daily basis people in the medical field, be them doctors, nurses, athletic trainers, who still don't understand what a concussion is, and these are people on the front lines taking care of athletes with concussions. So there's so far that we need to go to get everybody on the same page in terms of understanding what the problem is. Once we understand the problem, then we'll be a whole lot better at trying to find the solution. So then our first step is education and awareness, which is why we all, you know, do these types of things like we're doing today.
Imani, can you explain to everybody what the expression "get your bell rung" is?
Well, basically what that means is when someone says that you got your bell rung, it means that you got hit, and you're like you shared, is that you're a little dazed, and you know, it sort of takes you a minute to snap out of it. And it is probably a precursor to what we now know as having a concussion.
Right. And doctor, how dangerous is it, or how dangerous was that expression for people to use? And you know, do you hear examples? I mean, do you hear stories of people still using it?
all the time. And, we have a big problem with the nomenclature and how we describe things because people tend to minimize this injury. Concussion is otherwise known as MTBI, or mild traumatic brain injury. So even in the title,
wow,
it's described as being a mild injury. It's not. It's, it may be a hidden one. It may be one that we can't see, but this is a very devastating injury. And there's no such thing as a mild concussion versus a severe concussion. A concussion is a concussion. And what Amani described is getting your quote unquote bell rung, or feeling dazed, or seeing stars, however you want to say it, all of those things, those are concussions. Those are not precursors to concussions. Those are not, a little mild on the concussion scale. Those are concussions. Concussions present themselves in many different forms. And the definition of a concussion is an alteration in brain function following an impact like that. So when you have an impact and you have an alteration in brain function, be it feeling dizzy, feeling nauseous, having memory problems, feeling a little bit confused, even if it's only for 5 or 10 seconds, that is a concussion. And the problem we have is that since people don't identify that as a concussion, that happens all the time. When I see patients in clinic and I say, how many concussions have you had in your life? They say 1. I say, okay, how many times have you had an instance where you had a helmet-to-helmet contact and then you felt a little bit dizzy or confused afterwards? They say, Doc, that happens all the time. I probably had 30 or 40 of those. Well, then, my man, you had 30 or 40 concussions. Those are concussions. We have to understand that.
I think that raises the most awareness right now.
One of the things that, first and foremost, it's important to point out that these players are trained to hit hard. They're not trained necessarily to knock people out. But in the most extreme example that we saw, the New Orleans Saints had a bounty system that rewarded, I think, between 22 and 27 players, according to ESPN, for hard hits that injured opposing players. The fact that this is even part of the conversation should be an extraordinary alarm about what's going on and how dangerous this is, and the fact that it was actually sanctioned by people within the NFL, is despicable.
If I can jump in, I would say that there needs to be a major culture change in how we view the NFL. If we look at wrestling, for example, professional wrestling, we know that that is not the type of wrestling that occurs at the high school level. We know that this is purely entertainment. We know that it's extremely dangerous. We don't try to have our kids wrestle the way we see professional wrestlers wrestle. In football, it's different. We hold the NFL up to be this icon of the way football should be played. Kids in Pop Warner want to play football the way they see it on Sunday. Same thing in high school, same thing in college. However, the NFL is always going to be a different type of football. The NFL has a major problem, and they know this. The NFL is not going anywhere. Obviously, it's the #1 sport in America. It's a bazillion-dollar industry. Football, as we know it in the NFL, is not going to change significantly. There may be some changes here and there, but it's not going anywhere. Now, you take that on one side and compare it to what I said earlier, that every time a player gets their bell rung or feels a little dazed, that's a concussion, and they have to sit out, and they need to be cleared, and not the same day. It's going to take days before they're cleared. If you have a roster of a certain amount of guys, and this dazed bell ringing is occurring on almost every play, then there's no way that you have enough players on an NFL team to continue to play the game of football, defining concussions and treating them the way they should be treated. So there is a real logistical problem with the NFL.
Doctor, I got 2 questions just based on what you're saying. One is, how important is it, in your opinion, to have at every game, on every stadium, on the sidelines, a concussion specialist or a doctor there to be able to diagnose, not just team personnel? Should it be necessary across the board?
That would be fabulous. But again, we can't use the NFL as our standard, because if we do that at the NFL level, can we do that on the level of Pop Warner? Can we do it at high school? Can we do it at college? No. We cannot have these concussion experts on the sidelines. There's not even an athletic trainer at most football games at the lower levels. There's no medical staff. And now we're talking about setting up the standard of care to be a professional concussion expert on the sideline in order to play a safe game of football. How can we reproduce that at the lower levels? We can't. So we need to understand and accept that football at the NFL level should not be the football that we play at the lower level. It has to be something different. It has to be this gladiator sport that is entertainment and is not sport the way we play it at the lower levels.
And Doctor, just final question. Kringle, watching in the comments, wanted to make sure to get this question in. Kringle says, I bet you there are similar injury risks in other sports and other professions. Obviously, this isn't limited to football.
Yeah, that's correct. And, we kind of been talking about whether we would let our sons play football. I wrote an article for the LA Times about that specifically. And I would think of all our 4 panelists here today, I'd probably be the one who'd be most likely to not let my son play football because I see it every day in clinic. I see the injuries. But actually, what I wrote the article about is that I would, in fact, let my son play football because, as you said, there are so many other things that put you at risk as well. There's a greater risk of you getting in a car accident on the way to practice than there is of having a traumatic injury at practice. Football is a great sport, and, all contact sports are great sports. They're opportunities for kids to learn and to develop social interactions and to develop trust and to develop confidence. There's so many great things that sports have to offer. Yes, there's injuries. Yes, we should do everything possible to minimize those injury risks. But if these kids aren't going to play football, what are they going to do? They're going to do something else, which may be just as risky.
They're going to play soccer instead.
Soccer, the highest.
They're going to play tennis. They can play golf. There's a ton of sports that don't have head injuries in them that they can get all of that social interaction from.
The risk of head injury in women's soccer is almost equal to football. There is tremendous risk for concussion and head injury in female soccer. There's risk in everything we do, whether it's skateboarding, skiing, snowboarding. If my kid's going to, throw on a helmet and go ride a motorcycle because I refuse to let them play football, there are so many things that they can do that get them into trouble. So the best we can do as a parent and as a medical community is try to protect them and minimize the risks wherever possible, educate as best we can. But I think to say that, absolutely this is something that should not be done is a little bit flawed.